There are 5 basic massage stroke: effleurage, petrissage, friction, vibration, and tapotement. Effleurage, from the French word effleur, means to stroke. It is unbroken gliding movement repeated following the contour of the body using palm, knuckle, fingertips, and forearms. There are 4 variations of effleurage: one-handed, two-handed, alternate, nerve stroke. Rationale: used to introduce touch in applying lubricant as it prepares to transition of strokes. Benefits: reduce stress, improve circulation, and prepares the body for a deeper massage technique. Ironing: tip using palm, fist, or forearm. Raking: 2 or 5 fingertips together or apart with pressure. Circular: palm gliding on skin in circular motion. Heart shape: long deep strokes done by moving both hands in a heart-shaped motion. Circular: one hand over or beside the other in a circular motion. Third variation is alternate. There are 2 sub-variations: raking, same as one-handed raking but using 2 hands alternately. Circular, alternate circular hand movement. Nerve stroke, very light finger tracing. Petrissage, from the French word pétrir, which means to knead. Other term is kneading. It is a cycle of rhythmic lifting, squeezing, and releasing of tissue. 5 variations are one-handed, two-handed, alternate, fulling, and skin rolling. Rationale: it breaks down the muscle knots, improves blood flow, and increases range of motion. Benefits: relieves muscle tightness, improves circulation, and enhances flexibility. One-handed, simple clamp squeeze. Two-handed, praying hands, fingers interlaced, palm squeezing upward. Ocean waves, gliding hands in opposite direction with compression. Alternate hand, grasp and release alternately. Fulling, palm or thumb pressure separating while moving forward. Skin rolling, lifting skin and superficial fascia with no downward force. Friction, from the Latin word fricare or frictio. Other term is rubbing. It is done by compressing of tissues in several directions. Sliding hands, palm, fingers, and knuckle back and forth over skin or deeper tissue layers, usually dry or without oil. Rationale: often used in areas that lack muscle bags such as ligaments and tendons. Benefits: reduces pain, improves mobility, and breaks down adhesion. It has 6 variations as follows: superficial warming or heat rub with a sub-variation sewing, rolling, ringing, cross fiber, chucking, and circular. Superficial warming or heat rub, palms moving briskly in opposite direction. It has a sub-variation sewing, using the ulnar part of the hand to scapula or any bony part of the body. Rolling, hold limb with open hands back and forth from distal to proximal. Ringing, grasp firmly while twisting in opposite direction. Cross fiber, or deep transverse friction, fingers movement perpendicular to muscle fibers with moderate to heavy pressure. Chucking, same direction as muscle, tendon, or ligamentous fibers. Thumb or fingers move back and forth. Last variation is circular. It is small circular movements that glide superficial tissues over underlying tissues. Vibration, from the Latin word vibrationem meaning shaking. It is rapid shaking, quivering, trembling, or rocking movements applied with fingertips or full hand. Rationale: Performing vibration correctly requires coordination and practice. Benefits: relaxes tense muscles and stimulates circulation. Vibration has 4 variations: fine, jostling, coarse, and rocking. Fine, fingertips trembling the skin, fingers and wrists rigid, gliding along. Jostling, rhythmic and vigorous shaking back and forth. Coarse, grasped at most proximal point and slide down distally. Rocking, push and catch motion. Tapotement, from the French word tapoter, which means to tap or drum on. Other term is percussion. It is repetitive staccato striking movements of hands simultaneously or alternately using ulnar surface of the hand, fingertips, open palm, cup palm, or loosely closed fist. Rationale may be applied directly through the skin or through the drapes, avoiding heavy strokes over the kidneys. Benefits: stimulates nerve endings initially and helps stimulate local blood flow. Variations: tapping, pincement, hacking, quacking, cupping, clapping, pounding, and diffused. Tapping, using fingertips of one or both hands at various speeds. It has 3 sub-variations: punctuation or hard tapping. Pulsing, alternate deep, light. Raindrops, very light, fingertips tap skin at different times. Pincement, skin is lifted by grasping quickly at the point of striking. Plucking, same as pincement but in larger amount. Hacking, chop using ulnar edge of one or both hands with fingers relaxed or strike with last 3 fingers. Quacking, chopping with fingers interlocked. Cupping, cupped hands tapping. This loosens phlegm in chest cavity and may induce coughing. Pounding, loose fist beating in moderate strength. When applied palm down, it's called rapping. Clapping or slapping, palm striking skin with alternate strokes. Diffused, lay palmar surface on skin while striking back of hand to diffuse force moving across surface.